This is Acharya. I am second year medical student. What is your name?
Acharya.
You need to take any medication?
Glucorate.
Common causes and symptoms relating to the nose, mouth and neck, including nose bleeding and epistaxis, sore throat, hoarseness, swollen gland, and goiter.
So this is a stethoscope, tissue paper, gauge, otoscope, hand gloves, pen light, tongue blade, and hand sanitizer. Now we will do nose examination.
Physical examination. I use hand sanitizer for good hand hygiene in patient care. First, I inspected the anterior and inferior surface of the neck, noting any asymmetry or deformity. And test for obstruction by pressing on each alar nasi in turn and asking the patient to breathe in and breathe out.
Breathe in gently. Breathe out. Breathe. Breathe out.
Then I tilt the head back and press gently on the tip of the nose and shine a light using otoscope into the vestibule to get a partial view of each nasal vestibuli. To inspect the inside of nasal passage, I used an otoscope with the largest cap or speculum. I inspect the speculum carefully, avoiding contact with the sensitive nasal septum. I hold the otoscope handle to one side to avoid the patient's chin. For nose examination, we noted normally the nasal mucosa is redder than the oral mucosa and display no swelling, exudates or bleeding, or any deviation, inflammation or perforation of the nasal septum. For next examination of nose, I palpating the sinus tenderness, then I press the frontal sinuses under the bony eyebrows, avoiding pressure on the eye. And then I pressure the maxillary sinuses. Examination. First I wear the gloves. Then I inspect the outer surface of lips for symmetry, color and moisture. Then I inspect lumps, ulcers, cracking or scaling. Then I tell patient to open your mouth wide.
Will you open your mouth?
Then I use light pen and tongue blade to inspect the oral mucosa.
Gums.
Then I note the color of gums, inspect the gum margin and interdental papillae for swelling and ulceration. Also inspect the teeth, noting any missing discoloration abnormality.
Ah,
With my gloves, thumb and index finger, I check for any teeth that might be loose.
hard palate.
Then I inspect the color and architecture of the hard palate.
Oh.
Then I tell
Open your mouth
patient to
and
give
say
me just
ah,
big ah.
ah.
Then I
Tongue
ask
out.
patient to say ah to note the movement of the soft palate and uvula of the soft palate should rise symmetrically and the uvula should stay in the middle line.
Tongue out. Deep breath.
For clear view, I use tongue blade to depress a tongue gently and inspect the anterior and posterior pilar tonsils, pharynx, and uvula.
Shut down. Stick out your tongue.
For continued inspection of tongue, I inspect the dorsal surface of the tongue, which is roughened by papilla and sometimes covered with white coating. I palpate, so I examine any notes, any ulceration on tongue. By the using
Right
of
side.
gauge square, I use my right gloved hand to grasp the tip of the tongue and gently pull it to the patient left to inspect the undersurface and side of the tongue. Then I palpate the tongue with my left gloved hand and feeling for same for the left right tongue ulceration and nodules.
Done. Now we proceed for neck
Examination. I am standing in front of patient for the inspection of any symmetry, asymmetry, any masses, scars on neck. For example, thyroidectomy. Then I palpate the lymph node using the pads of my index and middle fingers. I palpate the anterior superficial and deep cervical chains, including the supraclavicular node, located anterior and superficial to the sternomastoid. Then I feel for the preauricular, posterior auricular, tonsillar, submandibular, submental, superficial cervical, and posterior cervical nodes. Then I palpate the posterior cervical chain along the anterior edge of trapezius and along the posterior edge of the sternomastoid. Next, I start the examination of thyroid by inspecting the patient's neck, tip the patient's head back a bit and inspect the region below the cricoid cartilage. For the thyroid gland, with endangered light, I am able to see the lower shadowed border of the thyroid gland. Then I tell patient to extend her neck back slightly and sip some water and swallow. Then I observe for upward movement of thyroid gland to palpating the thyroid gland by visual observation. First, I locate the isthmus, usually overlying the second through four tracheal rings. Then I move behind the patient and place the finger of both hands on the patient's neck so that my index finger are just below the cricoid cartilage. Then I ask patient to take a sip of water and swallow it. Then I feel thyroid isthmus rising under my fingerprints. Then I palpate right node and then left thyroid node. Because my patient had thyroid since last 15 years, so I clearly palpate left lobe mass. Then I listen over the lateral lobe with a stethoscope to detect a bruit sound similar to a cardiac murmur. I clearly listen it in left lobe.